A top health official is warning that the United Kingdom is at a tipping point in the COVID-19 pandemic. Almost 13,000 positive tests were returned in the last reporting period, and Prime Minister Boris Johnson is about to announce new restrictions. Here's our reporter Nick Dole in London.
Right now in England, there's about 3,000 COVID patients in hospital. It's roughly the same number as when Boris Johnson announced the national lockdown back in March. And while there is still capacity in most hospitals, the fear is that that could change within a matter of weeks. And when you look at the sorts of numbers we've been seeing over the last week or so, you can understand why there is so much concern. England's Deputy Chief Health Officer, Jonathan Van Tam, has written an op-ed, essentially to the nation, saying the country is at a tipping point and that the worst is yet to come unless we act now. He says while the initial spread in this wave was among young adults primarily, he says it's now spreading to older people, and in his words, just as night follows day, increases in deaths will follow. So on Monday UK time, the Prime Minister Boris Johnson will announce new restrictions. They're likely to involve the closures of pubs and restaurants in the north of England, potentially in places like Newcastle, Leeds, Liverpool and Manchester, where the infection rates are high. The government's been criticised for having too many layers of restrictions. Some people say it's too convoluted. So Boris Johnson's expected to outline a tiered system or even a traffic light system. So if you're in the red zone, you might be banned from going to the pub or from seeing friends. But if you're in the green zone, you might be much freer to go about your daily life. Of course, all of this is designed to avoid a full national lockdown, but even the government's scientific advisors say that can't be ruled out.